Hello all. So DNC or the endometrial biopsy is one of the most common procedures, and I see a lot of women coming home with the note saying that they have been advised DNC under anesthesia. I'll show you something very wonderful where she doesn't need anesthesia, and it can be done as an OP-based procedure, and very simple and kind of uncomfortable but not painful. Okay, so I'll show you what is this. Disclaimer: I'm not an agent, or I don't get any commission from this company. Okay, so it's called Allwyn Endometrial Biopsy Sampler. How does it work? So you have two things. One is a syringe with a lure lock, and you can see two metal springs in it. Can you see? Yeah, okay. And you have a Pipelle with the markings on it. And you can see it's barely 1.5 millimeters. Okay. So if you're doing endometrial biopsy in postmenopausal women or women with previous sections, make sure you put some miso so that there's a dilatation or softening of the cervix and not uncomfortable for her and not difficult singing. Okay. So you connect this U lock. Okay. So I'll borrow a uterus. So imagine this is the uterus. Insert into the uterus. Once it's gone into the uterus, it will create a vacuum. You can use these markings to check the uterocervical canal as well, just in case you want to insert a Mirena or a Kothapet at a later stage. Okay. And then now if you look at the syringe, I'm pulling the syringe, and you can see a metal clip. And now a very good vacuum is created, and you don't need to do much. Try to withdraw 2 centimeters so that it comes from the fundus till the internal os. And then while you're doing that, do a compound action, forwards and backwards, and rotate at the same time. Why should you rotate? You can see there's a hole on one side. So if you're rotating, it will gather cells from all the surfaces. Okay, so now that, and most often if you see a hyperplastic endometrium like 30 or 40 millimeters, I don't do much actually. I put the Pipelle, and the sample nicely gets collected into the syringe. Almost half of the syringe is filled. Once I'm happy that I have enough sample, it works as therapeutic as well in those women who are having heavy bleeding or spotting. It works as therapeutic as well. You remove this, don't push it. If you can see these two metal things, press them together, push them in, and then empty this into a container. It says once you get those pens into it, empty into the container. And then once you remove the lure lock, because there's no vacuum, the rest of the tissue in the tube will go into the formalin bottle. That's it. Simple.